doing some dry needling on Lacey's elbow for some tendonitis symptoms. When we do dry needling, we first set the needle. The patient usually feels just a little bit of pressure, and sometimes we get muscle twitch. When we're doing different points through the body, we'll do specific trigger points, or what we call homeostatic points, where there's overlap between acupuncture points and motor points of the nerve. You can see a little bit of muscle twitching going on right there as we do Lacey's needling. And that twitch response is usually the muscle kind of resisting the needle, which provides a good amount of stretch and relaxation for the patient. A common area that we treat with dry needling a lot is the lumbar spine. Quite often there's muscle spasm in the erector spinae and trigger points, and we use the needling to reduce the tightness and trigger points in those muscles. So I'll just demonstrate on Lacey here how we do some of the needling. The needles that we use in dry needling vary in length. This particular needle is a 0.25 by 50 millimeter. You can see they're very flexible. The needles bend easily to allow us to work different trigger points, and it's a solid filiform needle. And the needles are Teflon coated, so they both go in and come out very easily. And the needle lengths vary depending on the part of body we're working on. We may use as small as 1/2 inch needles or as long as 3 or 4 inch needles. Typically we'll leave these needles in place for 8 to 10 minutes. There seems to be some relaxation and improved circulation around the needle sites for about that length of time. There are points where we'll go in and out only, but in this area we would typically leave the needles in for a few minutes. After that, we'll just remove the needles. One of the variables we can do as we go further into treatment is just manipulation of the needle. So sometimes we'll do some turning or some pistoning of the needle if we wanted to treat a specific muscle trigger point.